A new report shows some staggering numbers about mental health in children. It finds anxiety and depression went up 26% among children from the ages of 3 to 17 nationwide in 2020. It also breaks down these numbers by state. ABC4's Kayla Baggerly live in the newsroom tonight. And Kayla, what did it say about Utah?
Glenn, Utah scored well in many areas of the report, including first in family and community. But child advocates say that there is one area of concern, and that's mental health. The report showing that 13% of children in Utah struggle with anxiety or depression.
Being not around a lot of people, I feel like it definitely worsened my anxiety.
Bella Turner says she started noticing symptoms of anxiety, depression, and OCD when she was just 14. 2 years later, the pandemic was a very difficult time for her.
I began to become very suicidal as it was coming about because I was just in a constant state of panic.
Martine Munoz with Voices for Utah Children says the Annie E. Casey Foundation 2022 Kids Count data book shows that in 2020, 13% of children in Utah from the ages of 3 to 17 experienced anxiety or depression, but that number just comes from those with a diagnosis.
The concern is trying to figure out how many children really are suffering.
He says some factors to these numbers could be a shortage of healthcare providers as well as stress brought on by the pandemic.
We learned a lot of the disparities within our society and the crisis that is now becoming a mental health pandemic for our youth.
CJ Powers, a psychologist with the Huntsman Mental Health Institute, says there has been a trending increase in mental health conditions in children since before the pandemic. He says it's important for parents to have conversations about mental health with children early on.
Ask about how are you feeling, what's going on, and really listen.
Bill is saying if you're struggling, reach out and get help.
There's people around you that love you and that want to help you get through this hard time.
Experts say some signs to look for in children are if they start to seem more withdrawn, sleep more or less, or have sudden changes in mood. Reporting live in the newsroom, Kayla Baggerly, ABC4 News.